This is Mayor Ken Tedford. I'd like to call this meeting of the Central Nevada Health District to order. If we'd all stand and
This
pledge
conference
allegiance
will
to the
now be
flag.
recorded.
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Has the agenda been posted in compliance with NRS?
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 8th day of January 2026 between the hours of 2:40 p.m. and 5 p.m. at all the locations listed on the agenda.
Would the clerk take roll?
Chair Ken Tedford,
Here.
Bob Erickson,
Here.
Denise Ferguson,
Here.
Jeb Rowley,
Here.
Don Witten,
Here.
Brandon Chaddick,
Here.
Connie Gottschalk, Tony Roos,
Here.
James Zubernis,
Here.
Nicole Cooley.
Here.
That's it.
Okay, I think we have a quorum, so we can proceed. Item 5 is for public comment, general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Being no public comment, we'll go to item 6, consideration and possible action on approval of the agenda for January 15th, 2026 meeting as submitted or revised. Do I have a motion to approve today's agenda?
Mr. Chairman, I move that the agenda be approved as submitted and posted.
We have a motion to approve. Do we have a second?
Dr. Tim Zabarnis, second.
We have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. We'll go to item 7, consideration and possible action on the minutes of the meeting held on November 13th, 2025. Does anybody have any corrections or additions to those meeting minutes on November 13th, 2025? Hearing none, I'd entertain a motion to approve those minutes.
For the record, Denise Ferguson, I'll make a motion to approve the minutes of the meeting held on November 13th, 2025.
For the record, Don Witten, I second that motion.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? None opposed. The motion carries, and the minutes of January 15th, or of November 13th, 2025 have been approved. We'll go to item 8, consideration and possible action on the acknowledgement of Commissioner Hyde's appointment on the board. I don't see anybody who was going to swear him in. Oh, I'm sorry. I didn't see you sitting back there. On behalf of Churchill County. So at this time, Mr. Hyde will be sworn in, and we'll acknowledge him as a board member for Churchill County.
I, Matt Hyde, do solemnly swear that I will support, protect, and defend
The Constitution and government of the United States.
the Constitution and government of the United States
And the Constitution and government of the state of Nevada.
and the Constitution
think you have to sign that. Mr. Carner, what would you like as far as an acknowledgement? I mean, the county makes their appointment, we just need to accept it, so would you like a motion to accept it, or? I mean, we can't turn it down. Okay, thank you. Welcome aboard, Matt. What were you struggling with? You've been sworn in like 10 times on 3 or 4 different boards. Come on, you should know that by heart.
Always been Pam.
Yeah, thank you, Matt. We'll go to item 9, consideration and possible action on appointment of the chair for Central Nevada Board of Health for the calendar year 2026 per approved by the bylaws.
Mr. Chair, I would like to nominate and approve for appointment of the chair of the Central Nevada Board of Health for the calendar year 2026. Mr. Mayor Ken Tedford.
I would second that motion and agree to ask that he continues in his role.
We have a motion and a second to appoint Mayor Ken Tedford as the chair for 2026 of CNHD. All in favor?
Aye.
None opposed? Motion carries. Thank you for your confidence. I'll continue to do the best job that I can for the 4 counties and for the city and for the people who live within those areas. Let's go to item 10, consideration and possible action concerning appointment of the vice chair for Central Nevada Board of Health for calendar year 2026 per the approved bylaws.
Mr. Chair, I would like to nominate and appoint for vice chair of the Central Nevada Board of Health for the calendar year 2026, Don Witten.
Jeb Rowley, second.
We have a motion and a second to appoint Don Witten as vice chair of Central Nevada Health District. All in favor?
Aye.
Aye.
None opposed? The motion carries, and Don, you have been appointed vice chair. We'll go to item 11, consideration and possible action concerning the final reading and approval of the amended bylaws for the Central Nevada Health District Board of Health. Wade or Shannon, which one's handling this?
For the record, Shannon Ernst, Interim Administrator, CNHD. So at the previous meeting, we did bring before you the change of the bylaws. Basically, it was a cleanup. There was some conflicting. It said 1-year term and 2-year term, so that's been cleaned up to say 2-year term throughout. So today would be the final approval, if you so move.
I think we discussed this before, and we said to bring it back this month.
We had to have the first reading, the last meeting, and
Yeah.
then the approval today.
Okay, are there any questions on this amended bylaw? If not, I'd entertain a motion to approve the amended bylaw.
Mr. Chairman, Bob Erickson for the record. I would move to approve the amended bylaws as published.
Do we have a second?
Mr. Chair, I would second that.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and that amended bylaw has passed. We'll go to item 12, consideration and possible action concerning the review and approval of the updated organizational chart, removing the administrator doctor position. Shannon?
Shannon Ernst, Interim Administrator for the record. So previously, you had approved structure number 2, which was really aligning an administrator and a doctor together. The ultimate goal with this was to move into being able to provide jail medical. When we took this back to the Board of County Commissioners for the increased salary, because we had not been successful in hiring, it was brought to the table, the concerns of the amount. A portion of that, the majority, is 64%, was going to Churchill County until there was the billable to Medicaid and those things. At that meeting, it was tabled, and through discussion with the chair, it was decided, based on this position has been open so long, that CNHD really needed to move forward to get an administrator. And so I'm bringing before you what we looked at previously. If you look at it, we have the closest one to our current structure is structure number 3. That was where really you had your health officer, you had your administrator. It didn't realign with where we wanted to go, where public health preparedness was on its own and aligned with where we've been hiring this whole time. So it's really looking at a recommendation that you proceed with structure number 1, because it does clearly define where we were going from when we had our retreat and what the board was looking for. If there's any questions, I could answer.
Are there any questions for Shannon on item 12? Okay, I'd entertain a motion to go with structure 3.
Structure 1, sir.
I'm sorry, structure 1.
For the record, Denise Ferguson, I'll make a motion to approve an updated organizational chart utilizing structure 1 and removing the administrator doctor position.
For the record, Dr. Jim Zabarnis, I'll second it.
We have a motion and we have a second. All in favor?
Aye.
Aye.
So we have moved to go to structure 1. I would like to go out of order and take item 14, the salary structure, because we just changed the structure to the different administrators, so I'd like to do the salary of that administrator next. That is consideration and possible action concerning approval of the administrator's job description and pay scale of 85. I think with that new job, and when we put it out, we had a problem with getting people to apply. I think on that county pay scale, I would like to move that to 85. That's in that attachment that you have with your packet from the 77 that it is currently at. And if you have any questions for me, I think it goes without, we know what we put out last time and it didn't work, so that's my recommendation. Are there any questions? If not, I'd entertain a motion to accept that pay scale.
Mr. Chair, I would move for approval of the administrator job description and pay scale to 85.
Do we have a second?
Mr. Chairman, Bob Erickson for the record. I second the motion.
We have a motion, a second. All in favor?
Aye.
Aye.
Pay scale will now be 85 at that position of administrator. The next item on the agenda, we will go back to 13, consideration and possible action concerning discussion and approval of the hiring process for the administrator position and authorization to negotiate and hire the top candidate up to step 10 based on qualifications. I've had some discussion with Shannon about this, and how I would like to proceed is to advertise, use the county personnel to advertise the position internally, how we've done it in the past. They would review the candidates to make sure that they meet the requirements of the position as we've set it up in the job description. Then I want to interview the candidates myself and do that for 2 weeks, and then bring back to you what I believe to be the top candidate. In the past, we've had some internal thing that didn't quite work with the last 2 candidates we brought here. And then bring back to you who I think's the best candidate, and see what you think after that period's over, and have you ratify that selection. I'm the chairman, and I think I should shorten this period. She's been doing this job for almost a year as an interim, and I don't want to keep delaying this process. And if you're willing to allow me to do that, I would surely appreciate it as your chairman to do that. I've had a lot of experience at doing that at the city for 30 years, and I think I can get that done. So if someone's, if you're all willing to let me do that, I would really appreciate it. And it's trying to set up committees and whatever to try to get to that point. It's just going to take a lot more time, and I feel comfortable in knowing what we need to get where we're supposed to be for these counties.
Mr. Chair, I'm more than comfortable with that. I think it'll streamline it, and we can get that done a lot quicker. You're elected chair by all of us up here, and that happened today, and I trust your judgment. I've seen you hire for the city, and you've always seemed to get top-notch people, so I trust your judgment.
Yeah, for the record, Denise Ferguson, I don't have a problem with it. I think the process needs to be expedited. We've been without an administrator for a period of time and going through different iterations of what we were going to do from an organization chart, and I think that we need to solidify that in some role so that they can feel good about whatever goals they have going forward for the year. So
Is that a second?
that's a second.
We have a motion from Matt and a second from Denise. All in favor?
Aye.
Any opposed? Motion carries, and we will get to work on that tomorrow. And I move pretty fast, and so hopefully we'll have this all back to you by next month. If not sooner, we'll call one of these virtual meetings to have a candidate for you. Thank you. Let's go to item 15. Consideration and possible action concerning ratification of the subaward grant between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District in the amount of $10,400 for the funding of the Chronic Disease Prevention and Management Program. Shannon.
For the record, Shannon Ernst, Interim Administrator. So before you have the actual award that we have,
My turn.
yes, there we go. So before you have actually our award that we received $10,400, this is to provide outreach and education within the communities regarding to chronic disease and disease investigation on those. I think really the team is working hard to develop a curriculum so that you're looking at we have high diabetes, we have high cardiovascular, so that we can do those educations in all the areas. So I'd ask for a ratification today of this.
Okay, any questions for Shannon on this subaward? If not, I'd entertain a motion to approve it.
Mr. Chairman, Bob Erickson, for the record, I would move that we ratify the subaward grant between DHS, HHS, Division of Public Health and Behavioral Health, and the Central Nevada Health District in the amount of $10,400 for the funding of chronic disease prevention and management programs.
We have a motion, do we have a second?
For the record, Don Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the subaward has been granted. Let's go to item 16, consideration and possible action concerning ratification of the subaward grant between DHHS, Division of Public and Behavioral Health in Central Nevada Health District in the amount of $43,006 to expand and maintain accurate abstinence and youth development in Mineral, Churchill, Eureka, and Pershing counties.
For the record, Shannon Ernst, Interim Administrator. So this is a renewal of the grant that Bruce previously we had in the previous years. One of the biggest issues we had was lack of staff. We had an amazing community health worker that was in Mineral, and the class was being taught there last year. Our goal was to make sure that we hit all counties. Eureka, it'll be a little bit different because we'll be partnering with the PACE Coalition there because they do also provide a similar program. The training only happens from now and then, and so we have 2 community health workers that are going through that certification. Then we'll be working with each community to determine which is the best location to have this. Such as in Mineral, it was at the schools. Some schools are reluctant to provide this, so we're looking at other partnerships, such as after-school programs, other youth programs. So we'll be aligning through that. We've already started that process this week, so that we can make sure as soon as the training's over, we can get this out. The goal is to at least train 50 youth in the year. We need to have a success rate of, I believe it was 75%. So it's an easy target. Last year, I think it tripled. Additionally, we do outreach at community events. We have flyers, we have outreach materials, and provide education. So if there's any questions, I can answer.
I think your idea of finding other avenues other than through schools who some resist this is a very good idea. Very good idea.
I agree.
Okay, any other questions or comments? If not, usually I always ask for public comment on each item, so anybody wants to comment at any time, I'm open for that. I'm sorry. Gosh, I've done that for like 30 years. If not, I'd entertain a motion.
For the record, Denise Ferguson, I'll make a motion for the ratification of the subaward grant between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District in the amount of $43,006 to expand and maintain accurate abstinence and youth development in Mineral, Churchill, Eureka, and Pershing counties.
We have a motion. Do we have a second?
For the record, Dr. Jim Zabarnis, I would motion to accept it. As a second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and this subaward grant has been approved. We'll go to item 17, consideration and possible action concerning ratification of a grant with KPS3 to create a health dashboard in the amount of $30,000. Shannon.
For the record, Shannon Ernst. So we received grant funding really to support the creation of this dashboard. We do not have a dashboard currently on our website that shows what are our current outbreaks, what are those levels and the trends. And so through this partnership, we determined KPS3 was a prime one. They do know our areas. They have worked with the state on dashboards previously. And so this project, actually the funding ends the end of this month, so they started launch so that we can make sure and meet that expectation. If there's any questions, I can answer.
Are there any questions for Shannon on this health dashboard agreement?
I guess the only, for the record, Denise Ferguson, but, so that'll establish it, is there like year-over-year cost to that? I mean, I think that dashboard's essential, but is there additional cost that you would see in the future?
Not on this portion. When you look at it, it's really them creating it, so we have the alignment. There is it's a concern. The data does not flow directly and automatically from the state. So Victoria Septet, our epidemiologist, actually pulls that data and would upload it. You have an item in here that we're looking at redoing the website. That's where the maintenance will come in.
Any other questions, comments? Is there any public comment? Hearing none, I'd entertain a motion to approve.
Jeb Rowley, for the record, motion to ratify the agreement with KPS3 to create a health dashboard in the amount of $30,000.
Do we have a second?
For the record, Don Witten, I second that motion.
We have a motion, a second, all in favor?
Aye.
Aye.
None opposed? The motion carries, and the agreement has been approved. We'll go to item 18, consideration and possible action concerning approval of a contract with KPS3 in the amount of $72,925 to redesign the KNHD website to increase accessibility and overall functionality, and authorize the interim administrator to execute the same. Shannon.
Shannon Ernst for the record. So this is where it's really redoing the website. If you take a look at our website now, it's really not easy to navigate. We want to make sure that anything you're looking at doing, you could get on and you could get your submit your environmental health applications, get an education process on that, look at having a feasible dashboard, and be able to locate all the services that we have. If you try to play with it now, it is not that way. There's a separate section that we'll have for Burning Man, special events that have a separate process. We did put this out. We received 3. And in review, KPS3 was the most responsive. This amount also includes the monthly maintenance fees for 1 year. We do have grant funds to support almost all of this, but 4.1%, which would come from the Central Nevada Health District General Fund, which is $2,900. And so we want to get going on this project as soon as possible so that we can align with the new dashboard and we can start educating the community from.
So you're trying to make this a website that I could get on
That would be the goal, sir.
and understand,
I would like to be able to
and
understand
be
it.
able to, like, navigate, as they say.
Absolutely. Absolutely. You know, when it was first built, and I'll be honest, I was involved in the first build out, we didn't know what CNHD was going to be. And so it was very simple, and it was really broke down into the 4 areas. We are doing a lot more. We have community health workers that are out doing outreach, they're doing follow-up. We need a robust website so that people can learn that process. How do they put in a referral if they have somebody that needs it? We want to make sure that it is easy and feasible.
Okay,
And I'll
well,
be happy to bring it to you before it rolls out, and we'll sit and play with it together. I'm kind of excited.
I'm not the guy to bring it to, let me tell you.
KPS3 also did our outreach, really branding project that we did. So they have amazing photos and videos that they'll also be able to place on here that's already done. So it brought the cost down a lot.
Okay, thank you. Is there any other questions or comments?
Dr. Jim Zabernas, for the record. So does this cost also involve any maintenance or changes to the website during the term of the contract?
So the first amount is a $68,425. That's a complete redesign of the website. And then the additional cost on it, $4,500, is the monthly maintenance for 1 year.
Okay. And monthly maintenance would include any changes that needed to happen to the, okay. All right,
Yes.
thank you.
We've been able to build a really good relationship with KPS3. They're able to give us some recommendations. I have them working on the social services side. I'm building a statewide Pinwheels for Prevention, Reduction, and Child Abuse campaign. So they really have gotten to know a lot of our communities, which is exciting, and they know the people that are trying to access. So we'll be looking for a lot of recommendations from them.
Okay, is there any public comment? Hearing none, I'd entertain a motion on item 18.
For the record, Dr. Jim Zabernas, I would move that we accept the consideration for approval of the contract with KPS3 in the amount of $72,925 to redesign the CNHD website.
Do we have a second?
Mr. Chair, Matt Hyde, I'll second that.
We have a motion and a second. All in favor?
Aye.
Aye. None opposed? Motion carries, and the contract has been approved. We'll go to item 19, consideration and possible action concerning ratification of the Verkada security equipment purchases through Carashoft, a state-approved vendor in the amount of $59,307.24. Don't leave the 24 cents out.
For the record,
Shannon.
Shannon Ernst, sorry. So basically with the remodel of the annex building for CNHD's new home, well, they're there, they're just in one part of it. We're going to move to the other part and it's going to be completely remodeled. We wanted to make sure and bring in a robust security system that also has mag locks so that everything is secure. This is a system that I actually placed in South Main Street. You can monitor it all from your phone. You can unlock, you can do the routing. So we did go through Carsoft because it is a state vendor for the Verkada system. This is also something we'll be able to expand to go out to our remote locations, and they would actually be Wi-Fi cameras so that we could provide those supports in buildings that are not owned or cannot make these kind of modifications to such a building. This is all 100% grant funded. It was through the SB 118 that has been sitting there and has to be expended by the end of this fiscal year. So I did already send them a PO so they could start getting our order ready. So it's a ratification today. If you agree, I would cancel the order if you do not.
Okay, any questions for Shannon? Any public comment? Okay. Back to the board for discussion or motion.
For the record, Denise Ferguson, I'll make a motion for the ratification of the Verkada security equipment purchases through Carahsoft state-approved vendor in the amount of $59,307.24.
We have a second?
For the record, Don Witten, I second that motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? The contract's been approved. We'll go to item 20. Consideration and possible action, ratification of pool insurance application submittal for liability policies. Shannon.
For the record, Shannon Ernst. So it's that time of year we have to put in for renewal for our pool policy. Basically, it's updating any equipment, staffing we have. And so this is a ratification of the application I put in. Once we do have the new costs and quotes, I'd bring that before you.
Okay. Questions from the board? Questions from the public? Back to the board for discussion or motion.
I guess, Denise Ferguson, for the record, on it, we just don't have a building value, and is it just like that's going to come in the future, or?
Churchill County and the other counties own those buildings, so
Okay.
we don't hold the insurance for those.
So we don't have to? Okay,
No,
just
we do
to
not.
clarify that that's not something we'd be responsible for in the future.
No,
Okay.
not at this time. Unless Central Nevada Health District actually owned a building, then we would have to add that on.
Okay.
Which could be in our future, you know.
Right, like through expansion, we could take that on from the county. Okay, just so kind of knew where it was. I was like, we're getting away pretty good from some of the stuff I have to fill out, so thanks.
Do we have a motion?
Mr. Chair, Matt Hyde for the record. I move for ratification of pool insurance application submittal for liability policies.
Jeb Rowley, I second that motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? It's not like everybody wants insurance, but we'll go to item 21. Consideration and possible action on review of the fiscal year 2026 revenue, expenditure, and grants to date.
Shasta Garrison is online to provide this presentation.
Hello, Hello, everybody. Shasta Garrison for the record. We've provided you with the current revenue and expense reports that were current as of the 6th of January. Currently, for revenue, we've brought in $822,000, $822,619.88, which is about a 31% of our budgeted amount. Expenses, we've spent just over $840,000, which is about 33.8% to date for our fiscal year to date. So we're pretty good under budget for expenses. Revenue, we've brought in quite a bit more since the 6th. Several of the county or our jurisdictions have paid their assessments. So next month, that number will be much higher. And then obviously we have quite a few grant payments that are expected here soon. The last sheet is the grant outline for all of our grants. We did have one that just ended on the 30th of December, and we were able to expend 100% of that grant. It's being renewed, and it'll be retro to January 1st. For, I believe, the same exact amount that we had previously. But we have a couple modifications that we're working on for the grants to be sure that we can expend them 100% by the end of the fiscal year, but we're on pretty good track to do so. I think that's all, if anybody has any questions.
Are there any questions for Shasta? Any questions from the public? If not, I'd entertain a motion to accept this financial report.
Mr. Chair, Jeb Rowley for the record with the motion to approve review of the fiscal 2026 revenue expenditures and grants to date.
Mr. Chairman, Bob Erickson for the record. I'd second that motion.
We have a motion and a second to accept the review of this financial report. All in favor?
Aye.
None opposed? Motion carries. And we've accepted the review. Thank you, Shasta. We'll go to item 22, staff reports.
Kathy Patterson for the record. Good afternoon, Mr. Chairman and members of the board. I'm presenting a review of clinical services for the combined months of November and December. For family planning, we continue to offer contraception, STI screening and treatment, and cervical and breast cancer screening. We continue to also offer VFC and 317 funded vaccines and screening for tuberculosis. We delivered blood pressure checks, individual health education as needed, and vaccines at 5 of our senior centers for a total of 12 visits. We have applied with the state to add on the following point of care tests, combination HIV, syphilis, urinalysis, and capillary lead testing to add to our exempt laboratory license. The next step is an inspection by the state, and then we can offer these tests to our patients. Excuse me. We've been working with our medical director, developing a shared clinical decision-making policy. This will help us with vaccine administration standing orders, as some of the vaccine recommendations have changed to be shared clinical decision-making. Clinical services has been working with epidemiology and one of our resource liaisons to implement chronic disease education on heart health in February and diabetes, I think, in April, to each of our 4 counties. Do you have any questions?
What do you do when What are you gonna do when you add heart and diabetes?
Excuse me?
What are you gonna offer when you have heart and diabetes?
It's a class about prevention of
So education.
heart, yeah, education, one class to about 2 hours each.
And so this is part of the grant that was just ratified at the beginning. It's really getting out those chronic disease education pieces so we can try to reduce some of our numbers.
But you're not gonna do blood screening or anything.
No, but that's a good idea for next time.
Good afternoon, Mr. Chairman and members of the board. My name is Maria Menjivar. I'm with the Environmental Health Services Division. I'm the division manager, and I'll be giving the update for the Public Health Preparedness Program and the Environmental Health Services Division. So I'll start with the Public Health Preparedness Program. At this time, we're still continuing our efforts to be present and actively participate in all the local emergency planning committees throughout the district. Whether it's Shannon Ernst, our interim administrator, or myself, we're happy to represent the program and help in any efforts or mitigate, provide any assistance as needed. And we'll continue that moving forward. For the Environmental Health Services update, you'll see here in your attached documents, you can see the amount of inspections we completed for the month of December. And you can also see the amount of follow-up inspections and investigations we completed, including construction inspections, which we're bound to do more this month, since we already have multiple construction plan reviews already here with us. As you can also see here down below on this attached form, you'll see that the health permit activities do account for 12 total unpaid health permits. Since then, some of these establishments have already paid their health permits, so this may be a little delayed as of today. Our division still continues to promote and encourage environmental health safety tips for the entire district. We do post on our social media pages quick little tidbits about food safety each week. So continue to follow us on all of the social media channels in order to find the latest and greatest for the community or for us that we're promoting out. In addition, hopefully next meeting, we're going to be presenting to you a new fee structure, a proposal for a new fee structure for the Environmental Health Services Division, in addition to another program, the Clinical Services Program for the Central Nevada Health District. And I'm happy to answer any questions now if there are any.
I keep turning this off because somehow it's giving you feedback, but what about these ones that have expired?
I'm sorry, say that again?
What about these ones on here that, for instance, the ones in the city of Fallon that had expired? These permits?
You mean like that they haven't paid? I'm sorry, this is Maria.
Is that what they haven't paid you?
Yes, they haven't paid their health permit.
So,
I guess my question, like, how are they allowed to continue to be open? I mean, yeah.
So this is Maria Menjivar with the Environmental Health Services, for the record. We do have a process on how to mitigate this situation for unpaid health permits. And so there is a certain time frame when we start to issue letters and delinquency letters and further out, including penalties and fees. But yes, we do have a process to be able to.
are some of these, I mean, I'm still signing business licenses, you know,
Oh,
in the
yes.
city, so there's some crossover, you know, that
Absolutely,
they
and we do
paid,
work
and
together.
And I'm
Yeah.
getting a stack like this, taking them home and signing, and so there's people who paid, and I just am signing, and sometimes I don't get them all signed every night, or, you know, during the day. And there's lots of them, so, I mean, you probably have lots of them too. So, like, and you don't have many in the city here, you have 2, 4, 6
Right.
that haven't paid you. So, could some of these be crossovers, or you just go knock on the door and tell them they gotta pay, or what? There's only like 6 of them here. What's the deal? I'm seriously, I want to know.
No, sir, and this was
I know these people.
I know, and I have called some. I know them very well. Hey, you need to start
So
paying.
like
So-
some of them paging, they just haven't.
So when
No, these people, if they page you, they wouldn't be on this list, because they're going to
Correct.
cross over at my house getting signed, yeah.
And so in March, when I came into the program, we were extremely behind. We had quite a few that hadn't paid, some up to 2 years. And so Maria and I worked closely together to actually develop a process so we can make sure that we're not being bill collectors necessarily, but we're doing that follow-up. But then also there's late fees that go on top of this now. And then also if they don't respond after that, we are reporting to the actual business department. So if you had one that got 120 days past due, we're going to contact your business license because you can't have a business license
Right.
and be operating without a health permit. And so we worked with Randy Hines over at Public Works with Churchill County to see how it would align with their code enforcement office, and then they could start pulling business license. This is beautiful compared to where it was at. Usually if you call and you run into them and you let them know, you do get it paid. But we would not let them stay open, and we notify the county or the city of the jurisdiction they're located in to request that the business license be pulled also.
Yeah, I mean, I just want to make sure that if you need support from us in our specific counties, that we're supporting you guys in that.
Thank you.
You know, they're all, I'm sure the names that are in Fallon are just as familiar to the mayor as the names in Mineral County to me. So we want to make sure that we're good stewards in our counties. Yeah.
Well,
Thank
there's
you.
3 at the end of December and 3 at the end of November, so it's not like they're like terrible.
No.
But they're not supposed to even have a business license if they don't have the, I mean, they have to show their health to get their business license. So these people haven't paid for their business license yet either for the end of the year. I'm gathering.
Yeah.
But we're, like Denise and Hawthorne, we're not chaining up the front door of these places either.
It's a new process, and I think if you look at the hard work that is, can you shut that one off, Maria? Sorry, we'll go back and forth. There you go. So it was really coming up with the process and getting that implemented, and I will say Maria and Olivia and all the administration team that has supported them to call, get it done, I call it the hate mail. A hate mail needs to go out. It has came to this point where you can see no one is now over a 90-day period, which is very exciting for the health district. Then we'll be looking at if somebody got further back, now we're going to look at coming to you and saying, if this is in the city of Fallon, we need to look at pulling their business license. We go out and talk to them.
Bob is going to look at these tomorrow. That's his job. It's just unusual. And I remember the list was much worse than this when y'all got started. So
Maria
I
Menjivar
just,
as well. I was gonna say. I just wanted to add that this was 200 plus back in June, if you remember when you had that meeting. This was 200 plus overdue.
Eureka and Pershing need like a donut party in their town. Yeah, you need something fun there, Jeb, because you're zero.
There may have been a few phone calls to us that got us helping in the back
Yeah,
scenes.
they're awesome there. Good. Okay, thank you. You'll look at those tomorrow, huh, Bob? Okay, thank you. Dr. Ted.
Dr. Ted McDonald for the record. Thank you for having me today. I'm going to fill in for Victoria Spesic. She's not here today, so I'll be giving an outline on her epidemiology program update. Most of the information is there, and you can see that the big thing is the respiratory virus for this year has been particularly a rough one, and primarily the A virus with the K-clade, which was not predicted. And so because it wasn't predicted, the vaccines help keep people out of the hospitals, help them from getting sicker, but it's a little bit rougher this year. We've had 360 cases that have been verified, 23 hospitalizations, and 1 fatality. The fatality was an elderly person, so I'm 70, so anything over 70 is now elderly. And they had underlying problems, and they were vaccinated during this process. This is enough to where the Banner Corporation for Fallon, Nevada, and their corporations in Arizona, because this is not just a Nevada thing, it's a United States thing, are mandating wearing masks in their hospital and clinics at this point. So the community is responding appropriately. Nobody's hair is on fire, but they are washing hands, wearing masks. They were actually asking for self-quarantine at home for 7 days after symptoms start, at least, and wearing masks. The hospital here not only is trying to protect its patients, but also its staff, because they found early on that staffing was getting a little bit difficult. So they've done a great job, and the CMO and the CEO, Brett Aiken and Rob Carnahan, thank you, have both, we've been in contact, and they have got everything set up. They've got all the treatments. They have Tamiflu ready to go. So they're doing a great job helping to protect our community, and their providers are all on board with this now, and they're complying with the recommendations. Measles monitoring, there was actually a case in Reno, and it was someone who was going through the airport, of all the scariest places to be, an adult who has not been vaccinated completely. There are cases, and if you go to my report, I talked a little bit about a measles overview in the United States. I won't torture you with all that. It comes down to basically there's more cases than what we've seen before, and more clusters of cases. And a cluster, or what's called an outbreak, means that you have 3 or more people that are related in some way that have the same measles virus. Canada has lost their status as no longer being measles-free. They lost that back in November. To be measles-free, you have to have 12 months of very few or no measles outbreaks. The United States is on the verge of losing their status also. This year has been, let's see, so we've had 2,065 cases as of last week, and that is up from 2024, where they had 285 confirmed cases. Back under Victoria's, there was no real outbreaks, other outbreaks to report. Nothing is out of the ordinary with what we would normally see. Then I'll continue with mine. Kathy was nice enough to report that we're working on updating on our vaccine standing orders, also some background policies and procedures, so that we can talk about shared critical decision-making. I think I discussed that last time, but we're just about finished with what our policy looks like. We're addressing what it is. We know what it is. It's something that is a standard in medicine, but with a vaccination program, it takes on a bigger picture, because when you have all your vaccines packaged into this is what you're required to have, it's pretty much the practitioners and the staff can tell the patient, well, you're due for your measles, mumps, and rubella, and since it's a standing order required to go to school, whatever the case is, there's not a lot of depth that we have to go into it regarding their situation. The way things are being broke out now is that it's being treated as if it's an ancillary procedure or a procedure that's that we have to address. So in surgery, we sit down and we talk about the risks, the benefits, the alternatives, and we do that a lot more in those situations. And that's what some of these vaccinations have been moved to, is a place that's more time-consuming and pretty much time-consuming. It's not a bad thing, but it winds up like putting pediatricians behind, because they're going to spend maybe 15 minutes per vaccination going through the risk, benefits, and alternatives that in the previous system was covered under the fact that patients fill out paperwork, they read things, get everything done. There was no discussion required at that point. There has been a change. The CDC has recommended a change in our vaccine schedules, going from 17 vaccinations to 11 vaccinations, following a process that's going on in Denmark. By the way, Denmark is smaller than the Central Nevada Health District, but it's got 6 million people, and they have a very great system. They've got 90, without having any real requirement for having vaccinations, they have a 97% vaccination rate. And the vaccines that are not on their list are available to the folks there. So, and they've got a good studies of millions of kids a year, and they have done a great job in education. They've got a universal health system. They have lots of clinics. They spend a lot of money. They have lower death rates. They live longer, less diabetes, less hypertension. So they really don't look anything like the United States or the Central Nevada Health District. But, you know, we've got something in place, and we are going to make sure that patients understand what they're getting with this. The thing that came out day before yesterday is Nevada is not going to follow the CDC recommendation. They came out and said, we're staying with what we have right now. CDC recommendations are just that, they're recommendations. And at this point, we are going to continue making sure that we define what, you know, that we're going to work on making sure there's shared decision-making and it's documented, and that all our staff know how to do it, what it's about. We're even looking at having little tests that we take every year to make sure that we're competent in that understanding. I think that's all I've got for right now. Do folks have any questions for me?
So, for the record, Denise Ferguson, I guess, you know, we're continuing to see reduction in vaccination compliance, especially leading into school. I think it was reported that this is the first class of kindergartners that nationally where we're under the 50% vaccinated rate for particularly things like measles. So my thing is I mean, a lot of this came post-COVID, and you know, from a lot of reasoning, but how do we educate and change the stigma within the CNHD counties of those that are proven, and how do we do some kind of marketing or media where we're educating them on, you know, measles isn't just a rash, that it can cause very debilitating illness, including disease, and what are some of those things? So I understand, because I think you are going to see where you know, your primary care, family practice, pediatricians are all getting hit with this, and then schools are getting more declinations or denials. But how do we approach it from, how are we educating so that we're really saying, I understand there's going to be apprehensive behavior to not go forward with vaccinations, but there's 100 years of proven history as to why this should occur for at least these or something. So what's kind of our philosophy within CNHD related to that? That's kind of what I want to know. Not anybody else can chime in.
No, I'm with Denise. What are we telling people? I mean,
Dr. Ted McDonald, for the record. The clinical staff is, at this point in time, believes in vaccinations, and believe in herd immunity, believe in the science. And that's our story, and we're sticking with it. And that's one of the reasons why having a little bit of this in place is to verify that when we have somebody that is not very, just wary of getting vaccination, that we have taken the time to talk with them, present them the information, and presenting it as neutral as possible without shaming, because there is no shame in this situation. And I am just mature enough to have had friends with polio and to have seen the whole things. And my dad was with the Navy, and when we went to Japan, I had to get like another 20 vaccinations. So you look at my vaccination cards, and I guess maybe I could have been a rocket scientist if I hadn't gotten so many vaccinations, or if my mom didn't smoke. But it comes down to we have to have some compassion. And this may turn out over the next 5 to 10 years be a sad situation, because if the measles is a little bit of an indicator of what we're going to see for the future, then we are going to have tragedy.
well,
And
you can't have a soft discussion about this. I mean, we've seen it from our public comment in the past here. I remember a friend of mine who flies a lot flew me to Las Vegas, and we were sitting in a small little terminal there, and we were talking about it during the pandemic. You're either here or here, during COVID, and you, as he said, you're afraid to even say what your thought is because you're going to get beat up either way. You can't have a soft discussion in the middle of whether, you should be taking these shots to prevent COVID or
And I
or
think-
not.
Yeah, I think some of the things that we have brought up today, which is like using your website as an opportunity for education and actually the public to utilize and understand what our mission is, I think that that's an opportunity for us to gain more, because I don't think that our mission or directive is any different. We're adhering and advising and doing all of those things. But I think that we need to appreciate who is the people having children today. They're not me, I'm almost retired. So, what is that generation looking to for their information? They get the majority of it from social media, from websites, talking points, bits, Instagram, all this. We can't necessarily say that it's valid. It could be a friend or a neighbor.
Or their parents.
But yes, and so how can we put provoking snippets, because we also know that this generation does not like a 5 or 10 minute where they feel like they're getting a lecture. They want a 30, 40-second bite that will say, what's the truth about vaccine? And hit them with clear facts and bullets and really put some of that on. And I feel like these are some of the things that we need to develop to mirror what we're looking at from a goal with health and vaccine improvement, but with the marketing of what we're doing with our website. So I'm just saying that would be a nice thing to cultivate. Yeah.
So for the record, Shannon Ernst, and I think that's a big thing as we're looking at media. We had actually a call this morning. We're going to partner more with Eureka because we just have low utilization, knowing that we're there. Really boosting up our social medias. We were able to do the platforms through KPS3, so everything's standardized so that we have that branding. Then we, as part of my staff report, I was going to announce we've made an offer to a public health program coordinator, excuse me, almost lost that word, that's going to help us. So we'll have someone dedicated to help put this information out. Right now, we have staff that are very tasked to do their actual jobs, and then we need to pull it and have one person really working on it. And so a big push will be around school. Back to school, we like to hype up. This is why you should, this is why they're required to get them, this is why you should get them, and this is how you can get them. We will be at back to school events, providing the education as we did last year, because really talking to families helps also. When, you know, they're reluctant, no, and oh, maybe, oh, yes, we're in. And so it's using all of those methods, I think that we can increase that.
I mean, I think Denise hit on something about this attention span of, you know, like, flash on something.
It's gotta be
and
quick.
It's gone, you know, whatever, this. Someone sent me a
Snapchat,
thing to
it's there
look
and it's
at, and I'm not on any social media, and I'm proud of that. Because I get my input from citizens, like, pretty much directly. But someone sent me something, and then it went to some X, and I pressed that, and it disappeared, and then I couldn't open up whatever they want me to see. But that's what they do. It's a very quick whatever. So I never saw it. But I think it, you know, what is, for this generation she's talking about, that's having these kids that need these measles shots. And what is this, what is this thing, what is this that they're talking about? You know, maybe I should look into this. And then maybe they read a little bit longer thing, and then they educate themselves. They're smart kids that are raising these kids. They're smart. And that's how maybe we reach them, and you pull them in, and then you do the education like we were talking about on diabetes and heart. But it's on getting these shots for, you know, all the things we got when we were in school, you know. I remember telling someone during the pandemic, I don't mean to prolong this, but we got on a bus and went to North Side, and they gave us something on a sugar cube, and we got back on the bus and went to West End, and no parent was laying in front of the doorway stopping us. You know, it just happened. And no one had a discussion, you know, and if there was going to be a discussion, it probably was behind closed doors where no kids were listening. But you can't have a discussion, so you have to reach these kids younger. And that generation has to learn how to talk to each other about things that they disagree on. But I think we need to use that social media even more than a big website.
And you can actually build some of these websites, social media, so they're feeding from each other, which is really nice, and that's way above me. I have no clue how to do that, but that's why we're going to have an expert help us do those things.
Well, you had some really young people on the KPS3 or whatever.
They're talented.
Bios, and they know how to do all that stuff.
So we'll bring those experts in.
Mr. Chairman, so speaking from clinical experience that we see that patients come in and they look at healthcare professionals as being part of the reason that they want to resist vaccines, because there was a loss of trust because of COVID. They would rather go to Google or Snapchat or TikTok is now kind of the big one. ChatGPT is coming online for all of this stuff as being authoritative as opposed to listening to us, who are allegedly the experts. So I think the point about the social media is definitely there. I mean, you have to meet them where they are, and there are benefits to having those little short snippets rather than kind of trying to force feed them the information, because that's what they want and that's what they can assume. And if they hear it often enough, I hate to use the word propaganda, but I mean, it's you have to sort of cognitively load them enough times where they start to believe it, because that's what the people who are doing these things on social media do. It's a repetition of a thought process over and over again. And then I think most people, if they hear something frequently enough, they will start to believe that it's true, whether it is or not. It just is a phenomenon that we've observed. So unfortunately, we're in a tough place because we as healthcare providers don't have the ability to talk to patients and convince them, because they think that we're part of that industrial complex that's out to get everybody, and that couldn't be further from the truth. But it's hard to overcome that.
That's
I think
a really
social
good
media
point.
is where is where you're going to need to focus. TikTok, I hear it from patients all the time. I saw on TikTok, it's a big thing. Yeah. Dr. Google kind of went away. It's Dr. TikTok.
That's how you
now.
cure me.
Yes. Thank you.
AI.
If I could offer some comment to Jeb Rowley for the record, and just thinking, two-part. One, information, accurate information, and Shannon, when we reported, or you reported in Eureka, and we were looking at statistics on the, what was it, flu, norovirus, something like that, and just thinking of, and I don't know, part one of the question, do you know if we've heard any information on that, on some of those statistics for what were being reported?
I do not have those here today,
And
sir.
that's fine, but it just came to mind, one of the things that I've been hearing a lot locally too is it has been a bad year. And nothing like a painful lesson to resonate with people, whether it's flu shots or perhaps another vaccine, right? And just a thought for the media marketing or web page is statistics are in essence a short message to see what is going on in your community. And I don't know if that's something that could be linked to, as a dashboard, again, what might resonate with some county residents if they see that half the county's sick. So just a thought with that.
So exciting news. This morning we had a meeting with your media team, and we are actually going to link your website up with our website so that we can be sharing some data back and forth so that we can get more, you go to Eureka, you go to Eureka's county's website, not CNHD's, but they can feed under your healthcare, then it can come to CNHD. So we are going to work on some of those so people will see those statistics from our dashboard when they visit your site. So those are some of the things we really want to push. The more we link together, the better people are getting more information.
Okay, is there anything else from y'all? Getting them back to you.
So I'm going to provide you with a quick overview of what I've been up to since the last time I saw you and some things that are happening. We released the RFP.
Thank you. I'm sorry,
Oh.
Shannon. Thank you, guys. Appreciate it. Okay, go ahead, Shannon.
So we did release the community needs assessment. This is the first part of moving to building our community and our health improvement plan. We were very excited because we received 24 responses. They ranged anywhere from 46,000 up to 199,000. We had planned on really making contact with everyone by tomorrow, but with this many, we have held that off until next Friday and notified everyone that they're in receipt and they are in review. My goal is to have this completed in the next week so that we can move to contracting. We're behind a year with this, so we want to jump on this as quick as possible and hopefully have the complete assessment but done by the summer. So then we can look into contracting to start that improvement plan. The whole team, I have never wrote a brothel letter of requirements before, but the whole team came together, and you have the Wildcat Brothel that is looking at reopening within Mineral County. Currently, they've received their health permit. They're working on the sex workers' contracts to make sure that they're monitored weekly. And so Mr. Karner is actually working on that agreement with them so that we can provide those services each week. And then we met with Denise Ferguson and her team with Matt Grant to be the backup, which they'll have a separate contract. So we would be looking at doing that, monitoring those testings each week. As Shasta mentioned, we're working hard at amendments for the grant budgets. One of the things is we don't want to wait too long. It takes at least 45 days to get those approved, and we want plenty of time to be able to spend accordingly and to spend 100%. We've had to pause for a moment because it is time to create our budget. And that budget has to go to the Churchill County Board of County Commissioners and back to you. So we are pausing, so we will have our draft budget completed within the next week and a half. Our goal is to take it to the Board of County Commissioners and just show those priorities, and at the next board meeting, we'll bring that before you. There's times then we will still have time to make any amendments or anything before April. The Rural Health Transformation Program, this is very exciting. It's $180 million, wow, I just screwed that up. $180 million was awarded to the state of Nevada for the next 5 years. This is something we have never seen, and it targets rural Nevada and healthcare. I've had a couple of meetings so far with the state and their priorities. They're very broad. A lot of it is for hospitals, it's a lot for workforce, but then it's also supporting capacity in rural Nevada. I have a meeting next week with the program administrator to talk about some of our high priorities. One of the biggest things is they want things that are shovel-ready. They need to get money out the door quick. They need to show the first year great success. Because if they don't expend the money or show great success, the next year they get a reduction in the amount they receive. So I'll be working with them on a couple of priorities, such as facility, the health improvement plan, how we can move also CNHD from not being within Churchill County structure so that they can gain accreditation. So it's really building those capacities. We did have the audit that was completed by Churchill County, which is our fiscal audit. It was reported last week. There was no findings. Everything came back clean. Central Nevada Health District, though, is at high risk. We have to be at high risk for 3 years. We're a new organization. It is what it is. So we're in year 2 with this. Well, we should be coming out of that next year. We have done our notifications to all the counties to notify them of the proposed assessments for next year. We're excited to say we have not touched any of our reserves, so that account is held at $200,000, which means that that assessment will not be increased to recoup up to that $200,000. So we wanted to give everyone projections. This was the goal when we started CNHD, to make sure that all the counties knew when they were going through their budgeting process how much it was going to cost next year. We will be sending out the final invoices, statements in May, so those could be processed for July, starting then. I think that is agenda process. We had some challenges with the agenda this time and last time, so I'm going to be looking at a new process for the agenda. I think we're going to go old school. We're going to get out a civic clerk, which is part of the Churchill County process, and there's a lot of people that do touch those. So we may be changing that so that we are just posting manually, and so you would get your packets like you are now, because you're not in civic clerk. That system's really built for people that are working within the Churchill County system. And I believe that is all I have for you at this time.
Okay, any questions for Shannon? If not, we're on item 23. The next meeting is scheduled for March 19th at 1:30. Does that sound good for everybody? Okay, be in here, and then, of course, virtual as well. March 19th at 1:30. Unless I have something for you earlier, then we'll get a hold of you. And probably do that virtually, maybe. We'll see how that works out, if we can get that done before then. Okay, I appreciate your confidence in moving in that direction. Item 24 on the agenda is for public comment. Any public comment? No public comment, so we stand adjourned. Thank you all, and drive carefully as you go home today. Appreciate your discussion.